Hello and welcome. If you're here, there's a good chance you're taking on one of the most important roles imaginable, caring for a loved one with cancer at home. We put together this guide to offer some support and practical advice for you on this journey. So let's get right into it. Let's just start with this, right here. What you're doing, it's a profound act of love and strength. It takes so much compassion, so much resilience. Before we even go a step further, I just want you to take a moment and acknowledge how truly significant your role is.
So, to make this journey feel a little more manageable, we've broken things down into 5 key parts. We're going to start with the foundation of care. Then we'll get into the practical stuff, the pillars of physical comfort. We'll also talk about the emotional side of things, how to stay prepared, and this one's crucial, how to find support for yourself.
Okay, let's begin with that foundation. When you really understand why you're doing something, all the how-tos just make so much more sense. This part is all about the philosophy that's going to guide every single thing you do.
So, what exactly is palliative care? Well, it's not really about trying to cure the illness. It's a different approach entirely. The goal is simple, but it's so powerful. Provide comfort, preserve dignity, and make quality of life the #1 priority. And that means we have to look at the whole person. We've got to tune in to their physical needs, things like pain and fatigue for sure, but just as important are their emotional and psychological needs, addressing the anxiety or sadness that naturally comes with this journey. All right, now let's move into our second section, physical comfort. This is where we take that whole idea of care and turn it into real, practical, hands-on actions. When it comes to managing pain, consistency is everything. There are really 3 simple but non-negotiable rules. 1. Give medicines exactly as prescribed. 2. Never, ever skip a dose. And 3. Always, always talk to the doctor about any changes. That's how you provide real relief. Hygiene is about so much more than just being clean. It's about dignity. Simple things like helping with a sponge bath or just making sure there are fresh clothes and bedding. They provide a huge amount of comfort. And at the same time, keeping things clean is your best defense against infections. Nutrition can be a real challenge, so the focus should always be on gentle encouragement. Think soft, easy-to-eat foods, and plenty of fluids like water and warm soups. Just remember, the goal here is nourishment and comfort, not pressure. Now here's a small action that has a massive impact. If your loved one isn't moving around much, just helping them change position every couple of hours is one of the single best things you can do to prevent painful and sometimes dangerous bed sores. Okay, so we've talked about the physical tasks. Now let's shift to what is truly the heart of caring, emotional support. And this isn't just about your loved one's well-being, it's about yours too. Please never underestimate this. Sometimes the most healing thing you can offer is just your presence, holding a hand, really listening, or even just sitting in comfortable silence. Your calm, kind energy is an incredible source of comfort. And this brings us to a really crucial question. While you're giving so much of yourself, you have to stop and ask who is caring for you. Your well-being isn't some luxury you can put off, it's an absolute necessity. And that's why it's so important to build these little moments of self-care into your day. It doesn't have to be a big deal. A 5-minute rest, a quick glass of water, a few deep breaths. These tiny things can make a world of difference. You've got to recharge your own batteries to keep giving the best care. All right, our 4th section is about staying vigilant. This is all about being a proactive partner in your loved one's care, thinking ahead instead of just reacting to things as they happen. A simple tool like a symptom diary can be an absolute game changer. Just by jotting down changes in pain levels, fevers, or anything else you notice, you create a super clear record. This lets you give the doctor specific, factual information, which helps them make the absolute best decisions. It is also so important to know when you need to get help immediately. If you see a sudden spike in pain, if there's any trouble breathing, or any other really sudden change, you need to contact a healthcare provider right away. Trust your gut on this and don't ever hesitate. Finally, let's talk about support. This whole journey can feel incredibly isolating sometimes, but it is so important to remember that you are not alone in this. You don't have to be. Professional help is out there. Organizations like SVT Home Healthcare Services can bring skilled and compassionate care right to your home that can offer you both relief and expert guidance right when you need it most. So if you feel like you could use that extra layer of support, please don't hesitate to reach out and make a call. Remember, asking for help isn't a sign of weakness. It's one of the strongest things you can possibly do. As we close, I just want you to hold this thought with you. Every single thing you do, every act of care, no matter how small it might feel, it brings comfort and it affirms dignity. What you are doing matters more than words can ever say. Thank you for letting us be a small part of your journey today.